most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to discuss the best best balance and walking exercises to prevent falls for seniors, especially after like a stroke, knee, or hip replacement.
Right. All these fit together, and you'll find out in just a couple of minutes.
Yeah, it's a very important thing to address because obviously poor balance leads to falls, which leads to disability and debility.
Right.
So
serious disability.
Right. If you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on bobandbrad.com, the giveaway section, because right now we're giving away a SleepOvation mattress.
He said SleepOvation mattress.
Yeah, you probably couldn't hear me.
Nice mattress. We love them.
Also a pillow. SleepOvation just invented a pillow. What's cool about this is it actually has springs inside.
Yeah, right in here.
You can't feel them. I mean, but it keeps the pillow so it doesn't collapse. I mean, it goes down, but it recovers right away.
This is what the full one looks like.
Yeah.
They're great.
Yeah, they're fantastic.
All right.
Get a shot at them. All right. And also, if you want to join us on Instagram and Twitter, we have a short version of our program. So
okay, Bob. They're wondering what about this balance and whatnot. So as therapists, we really look at balance, walking, avoidance of falls at a very detailed, and there's
a lot of components.
Right. And there's
that come into play.
Three big ones that you need to address. And this, we call it an obstacle course, addresses all three. The first one is vision.
Yeah.
The next one is the vestibular system in your ear. That though things make you dizzy, sometimes it kind of relates to that. And then proprioception, in other words, the feedback that your nervous system gives your brain, telling you where your feet are or the parts of your body without having to look at them. All of those contribute to having good balance.
All of them have to work together,
right,
in order to have balance. But you want to make sure you are addressing each one of those, or you might have a deficit in that area.
Right. And this is going to solve all three. It's going to really work at three of them. So the first thing we want to do is, if you are recovering, your balance is poor, do not do this by yourself.
Yeah, not by any means.
You have to have at least one person and maybe two people. We oftentimes have a person on each side. You have to have a belt, a gait belt, something that the helpers can hold on to, because you don't want to grab clothing or an arm. This works very well. So I've got my gait belt on. And then the person walking has to at least be able to walk with a cane. If you're walking with a walker, this is too advanced.
Yeah, that's too advanced.
Right.
Exactly.
So a cane or without a walker. I have some people that in the house, they can walk without a cane, but once they get outside in the yard on even surfaces, they have to have a cane, and then they need to do something like this to achieve that goal.
Or when you're in public.
There you go.
Because that's where we're going to talk about how you get distracted and have to look different directions.
Right.
With your vision.
Right. People can walk fine on the flat with their cane, but you put them on the flat in a mall with 200 people walking around, they become very unstable.
Right.
So this addresses that too. So should we get started, Bob?
Sure.
We're going to use hurdles. In the therapy world, I call these hurdles, and you can use anything. We got a couple canes that we're going to step over the top of.
Now, again, visualize that I'm going to stay out of the way, Brad.
Okay.
But normally I would be holding on to Brad's belt.
Right. So he'd be standing right next to me.
Right.
And again, sometimes you have two people. If they're that poor balance, you probably better take them to a therapist.
Yeah.
So we got two hurdles, and you could put more of these, 3 or 4.
Sure.
So you need to step over those without touching them. Now this is a squishy pad. You can use a cushion off of a piece of furniture.
Sure.
And put it down. Anything that's soft and squishy, that works your proprioception. We're going to step over that. And then we've got a step. Now, if you don't have a step like this, which you probably don't at home, but you may have a stairway at home, and you could go up to the stairway, and it worked good because you have a handrail to hold on to, and practice that. We can practice turning slowly, or you can go back down backwards. So we'll demonstrate.
So the obstacle course is set.
Yep. Here's the first set. Okay. Start out easy. Again, someone's there. standing by you, holding onto your belt, ready to help you if you need it. I'm going to use a Booyah Stik. You could use a cane, or you may not need anything depending on your balance. And we're going to step. And when you start out, you're going to look where you're going, making sure you don't hit the cane. Everything is going smooth. You can go one step at a time, go up here like this, and up, and just get a feel for it. And then turn around. And once you can do that and you feel pretty comfortable, it's easy. Well, then you can just try the step over like this, speed it up a little bit, maybe turn up here. You got to be careful because you got only half a step to step on if you're on stairs, and then go back. When that gets pretty easy, then we're going to work on your vision. You have to have the person going to pick out a point in front of you, in the right in front of you, a point on the wall to the left, and a point on the wall to the left or to the right. And you're going to look at those points, glance down where you're going, but then get up and look again, as if you're walking through a crowded hallway.
This makes it much more difficult.
Yeah.
And I mean, as Brad and I have found, a lot of people end up falling at like events like Christmas, Thanksgiving, and what's happening? They're getting distracted.
Right.
You know, normally they can focus when they're walking, but all of a sudden Aunt Lily says hi when she's walking, and she goes like this, and then she loses her balance.
Sure.
So this is to help train for these unexpected, you know, distractions.
Exactly.
Basically.
So if you're the helper, what you can do is say, you know, we're going to look at these, and you can start talking to the person at the same time, which also distracts the person. And that's real life.
That's all part of the training.
Exactly. Now, the next one we want to go to is sidestepping.
Sure.
So, because, you know, in your house, in the kitchen, you sidestep all the time. Sometimes you have to turn to get through a narrow spot.
Or get into the bathroom, or get into a closet, or whatever.
Exactly.
So if you're not working on this aspect,
I'm going to use this.
then when you do run into it in real life, you may lose your balance.
Right.
So you need to train for it.
Particularly if you've had a stroke or a replacement on one side, that one leg is typically weak, or you don't attend to the side if you had a stroke. So going one direction is almost always much harder than the other. So we want to try and get them equal, and take your time, get over it. You know, and if you find yourself one leg keeps bumping the cane or can't get up and over, then you're going to need to spend some time on really exaggerating with the weak leg, or the leg that's not working so well. In here, and then up. If the step is difficult, just practice going up and down on the step a number of times.
Yeah, do some repeats. If there's any particular thing that is giving you trouble, do the repeats, do the reps.
And if you're getting really good, and I'll do this with some people, I'll have them go backwards, because there are times you do need to back up into a chair or whatever.
Again, emphasizing that you're going to need to have somebody on the belt.
Yeah, because this really will make someone fall easy.
Right.
So this is
very difficult.
And the person that's helping is able-bodied, strong,
and
able to assist properly.
That they can stop them from falling.
Right. And you really take your time going backwards. And that one, like I say, I only do that with people who are really, they're not typically not a cane.
Pretty high level.
They're out walking around and doing well. Yep. All right, Bob, what do you say?
There you go. A nice little obstacle course. Very easy to set up, but very effective in training.
Right. So take your time with it. Be cautious. Always be safe with your belt and a good able-bodied person to help. So,
all right. Remember, Brad and I can fix just about anything
except for
a broken heart.
But we are working on that as well.
There we go. Finally, you're doing something, Brad.
Well, you know, I thought about it last night.